Good evening, everyone, and thank you for tuning in to Hotline 21 on CAN TV. My name is Jenny Brandhorst, and I'm with Beacon Therapeutic. I am filling in for our CEO and President, Susan Reyna Guerrero, who could not be here this evening. And with me as our guest is Sarah Jeck, and Sarah is with our FACT program, and FACT is Family Assertive Community Treatment. And we're going to learn more about this program in our next 25 minutes. But before we hear from Sarah and all the great work she and everyone on her team is doing within FACT, we're going to tell you a little bit about Beacon Therapeutic. Beacon Therapeutic has 4 different locations, and we have our administrative office, we have our homeless services office, we have 2 therapeutic day schools, one in Calumet Park and another one in Longwood in Chicago. And so you're welcome to call any of those numbers to reach us. You can also visit our website for more information. That link is on the screen, and I'll be putting this information up periodically throughout the show. But you're probably wondering, what does Beacon do? And we're doing a lot of things, and here are some of our programs. We are doing health outreach for young children. That's with our CHIPRA program. We're doing coordinated outreach and collaborative housing. That's COACH. That's a new program. We do early Head Start, and you learned about that last week with our guest Elena. The FACT program, which is what we'll be talking about this evening. We also do our HOMES project, which is Family Housing Outreach Mobile Engagement Services. Intensive outpatient programs. And we've got another sheet of programs, Little Intensive Outpatient Program, Mental Health Services, our PATH program, Shelter Outreach Services, and like I mentioned before, we have 2 therapeutic day schools. So as you can see, we've got a lot going on at Beacon Therapeutic. And one of our main taglines that we're proud of is that we are creating new endings from disadvantaged beginnings. And Sarah Jeck is going to tell us a little bit about that in the next 25 minutes. So Sarah, let's start off with you telling us a little bit about yourself and how you came to Beacon.
Well, like you know, my name is Sarah Jeck. I'm Specialized Services Clinical Supervisor at Beacon. I've been with Beacon for almost a year now. I came to Beacon with the opportunity of being able to supervise the FACT program, the Family Assertive Community Treatment Program. I was drawn to Beacon for several reasons, but mainly their focus on children and family services and helping to advance the lives of those that are served. I've been working with children and families for 11 years.
Wow.
I've worked primarily in the foster care system, working with young moms and young parents and families. And when I was presented with the opportunity to help run a program that specifically focuses on young moms and their families, I immediately tried to jump at that opportunity and was
And
grateful.
we're glad you did.
Thank you. And I have a master's degree from University of Illinois at Chicago, UIC, the Jane Addams School of Social Work. I have my bachelor's from the Illinois State University, also in social work. Really, my main focus and my heart is with children and families in the city of Chicago, and just helping to advance them in whichever way. And this program is really a great program, and I was happy to be able to participate and help run this program for Beacon.
Well, we're happy you're here, and obviously with your credentials, you have quite a bit of expertise behind you, and we're lucky to have you on board. I know you're an asset to the FACT team and as well as Beacon Therapeutic. So thank you for being here. I would like to start off with you describing, give us a detailed description of the FACT program, because there, as you know, there's a lot going on with FACT. So if you can tell us everything about the program, as far as people served and that type of thing.
Sure. The Family Assertive Community Treatment Program is a evidence-based program that serves young moms 18 to 25. And the real special thing about the program is it's a wraparound model for services. So we have 6 direct service and 1 community integrative specialist who helps us with the systems that really help us impact our families.
So that's the team, the
That's
FACT
the team.
Okay.
Yep. So there's 7 of us.
Wow.
The 6 that are on there is myself, who's the supervisor, but also therapist.
Okay.
We also have a child service clinical supervisor who also is a child therapist and a therapist as well for families, for the moms. We have an employment specialist. We have a housing specialist, and we have a child specialist, and then another therapist who specializes in substance abuse treatment if that's an identified need for the participant. What makes it really unique is that we all work with the same family on whatever goals that are identified. And it's not our goals, it's actually client-based. They identify what goals they have, what goals they want, whether it's housing, employment, education for their children. We really wrap ourselves around that family and that participant and help them guide their way through the various systems and the various programs that they need to in order to achieve whatever it is that goal is.
That is a unique process. If you could, I didn't mean to interrupt you, but if you could
Sure.
walk me through, say I was referred to the FACT program, would you walk me through the intake process and what I would be, I don't want to say up against, but what I would be dealing with when I come into the program and all the different, the entree of services that I would have for me?
Sure. So at intake, we would we would help you identify your service plan, so an individual treatment plan, which is your goal. So we would sit down with you for several hours and just kind of get down to what it is that you're wanting from us, what is it that you're needing, and how we can help. And then based off of those goals, every week or more weeks, or more times, we meet once a week or more, depending on the participants' needs. If they're intense needs and they need critical services, we will meet with them several times a week.
Wow.
But
that's not the whole FACT team, though.
Well, no,
certain
we
people-
rotate. You're
okay.
right. We rotate who meets with that depending
Okay.
on the need. But if
Sure.
it is a housing issue and they're needing housing services, that housing specialist will meet with that participant 2 to 3 times a week. If they're trying to apply for a housing program, if they're trying to get all their documents in a row for housing, then the other programs, the other persons, which therapists, anybody can help out obtaining those documents that they're needing for the housing. So we will just continue to meet with the participant at their request, however many times they need that service.
You're doing a lot of things. I mean,
We
I know.
are. I mean, it's really
everybody's
an
wearing a lot of
intense-
hats, and I think that's what's so interesting and unique. And it's an intense model, and there's a lot going on. And for everyone on the FACT team to be cross-trained, if you will, and you know, as a supervisor, you obviously know what everybody on the team is doing. But for the housing person to know what the system integration person's doing, and you're all you're wearing a lot of hats. You're doing a lot.
It is, and it takes a lot of communication with the team, it's a very good team where the communication is crucial, and we meet several times a week as a group to discuss that participant and what their needs are, to plan for the next meeting that we're going to have with that family, and then identify which one of us on the team is going to be meeting with that person that week. It really is client focused and client centered, and we really strive to meet their needs and have them pretty much guide us on what services they want.
And that's how it should be. I'm the one who needs help, then I need to know what's available to me. And I want to remind everybody out there, if you're tuning in, this is a live call-in show. I'm Jenny Brandhorst with Beacon Therapeutic. I'm with Sarah Jeck. She's with Beacon also with our FACT program. And this is a live call-in show, and I believe we got some calls now. So let's take some calls, Sarah. You've got a fan club here.
Good evening, ladies. I've been listening to what type of programs you guys have. I think it's real good and it's wonderful. But what are you ladies doing in terms of talking to the young women out there and trying to get them to sustain from having children real early in life? If we can get some of these teen women to not have children until they're 25, it won't be that domino effect that affect their children as well. Just one person needing services, we may have 2 or 3 people needing service. You understand the question I'm asking?
I think so. Yes. I'm going to let you take it. You're the expert with the family services and that. But it's interesting. It's an interesting question, kind of like a domino effect. I'll let you take that.
Well, I think with our program, we get them when they're 18, 25 and already have one child who's under the age of 5, or at least one child. I think With the FACT program, I think working in collaboration with other programs in the city, so the City of Chicago, the CPS school systems, I mean, all the systems, we have a system integration person who can help us identify different areas of the systems in the city that will help impact the lives of young parents. In preventative services, I mean, that's we discuss with the participants after they have had that one child of what the outcome and outlook would look for. You know, we educate on the next child and what you're doing to prevent that. I mean, we discuss family planning with them at any given point if that's something that's coming up. But I mean, it's the participant's choice. We can't tell them that they can't have more children. And really, it's just, we get them when they already have the child. But I understand your question. That's a great question. And I hope I answered it.
You're doing the best you can with providing resources and education to the participants. The caller brought up some good points, and I want to put just information about the FACT program on screen. This is just criteria to be enrolled in the FACT program. Single mothers, Sarah mentioned single mothers, 18 to 25-year-old, at least one child, 5 years or younger, homeless or at risk of being homeless, have a mental health diagnosis. Other factors include substance abuse, domestic violence, gang involvement, child welfare involvement, and children's emotional developmental needs. Is there anything else that we're covering or not covering on this list?
No, I think that's our services.
I'm going to put up another slide about basic services. Now, we know there's so much more going on, but this is just kind of an umbrella of services for the FACT program: family, assertive community treatment, mental health, crisis intervention, housing, financial literacy, employment, healthcare, parental skills. There's so much going on, and for you guys to know all of this is amazing, and we are appreciative of the work you're doing. But we kind of strayed from our questioning here, and that's a good thing. We're happy to have callers, and we're happy to discuss more about the FACT program. But let's talk about being referred to the program. What are the different referral sources that you have?
Well, I think at this point, we take direct referrals from professionals in the city. So if you're hearing this and thinking that you're a good candidate for this program and you think you could benefit from our program, please contact your caseworker at DHS, your WIC office, whoever it is, because we need a professional referral. So it's a referral, a phone call to myself at the agency, and I think we put up before the phone number. And I can reiterate it again. If you're interested in the FACT services and you're wanting to get more details on how to become enrolled, by all means have somebody in the community call us for more information. Our phone number at the Western office is 773-233-3821. And then we'll go through a screening process. It's about a 25-minute conversation, just asking about our criterias and whether or not you fit those criterias. And then we'll move along with the intake and meeting with you and developing that treatment plan.
Now, you had mentioned earlier that when a participant comes in, there's a rather lengthy intake process, and that's for everybody to get acquainted and gain everyone's trust, because I'm pretty sure a lot of the participants don't trust people. They've really had some hard times. We'd mentioned a good entree of services, but there are also some components of those services, such as CPP, child parent psychotherapy, and preventing child abuse and neglect. Could you go into more detail about those components?
Sure. Some of the child services that we have, our child specialist will meet with the family and help identify any needs and specific needs on the children. CPP, child parent psychotherapy, is helping the parent and guardian help that child who has been exposed to trauma or dealing with trauma. Sometimes you can see it with behaviors that the child may have, or the parents not being able to really understand what the child is going through. And this is an intensive treatment therapy. I mean, it's one-on-one with the child CPP provider, which we have several at our agency that can provide that service for the actual child and the parent. One-on-one
How intense
therapy.
is that? I mean,
It requires one-on-one every week for an hour. And it really is, it's hands-on therapy services of trying to just redevelop and reestablish, really getting the child back on track, trying to understand the trauma and how it's affecting. But if you're interested more into the CPP, we have the child parent specialist supervisor who would be able to assist with more information on that part of our program. We also have PCAN, which is the Preventing Child Abuse and Neglect curriculum, and that all of our staff on the FAC team are trained in that curriculum, which is education services for the parents, helping them understand the developments of children and why children are doing certain specific behaviors. If you have a nonverbal child who is age appropriately nonverbal, how to understand those signs and what they're wanting and how to interpret that. And then we also go into discipline, and then also, helping parents assist with different discipline techniques, and appropriate, discipline techniques that are age appropriate. We also do, trauma focus, or the brain development of how brains are developed, and how, when you're pregnant, certain things you can do affects the brains, those sorts of things, and really getting the parents to understand that children's development with the PCAN curriculum.
Okay, and then while we're talking about participants, I'm a firm believer that it's important to put, faces, because we're talking about all these programs, all these services, components, but it's really the people that we serve that make the difference and makes your work worthwhile. Would you agree? And I'm sure you can tell me some rewards or some success stories. I mean, you've dealt with a lot of different folks. Would you mind sharing a success story? I know there's many, but just one or two.
Yeah, definitely. I think, we count as the FAC team any small success as a big success. I mean, we look at everything. From having a participant make a WIC appointment that they've missed for three times already and rescheduling, that's success to us. A participant gaining employment is successful. One of the participants that we have that the team worked very diligently with and hard with that participant, meeting this person several times a week just to help them apply for a housing opportunity. They referred from the centralized referral system, which is the overall City of Chicago housing list. And then our participant is based on vulnerability, and one of our participants was picked. However, there's a process to getting actual approval for that housing. So the team really advocated for the participant and backed that participant up to where her and her family were able to get housed. And now she's housed and trying to figure out, learning stability in the home, how to have a home on her own, how to juggle families and home, children, and how maintaining a home. I mean, it's basic. We're helping them with basic skills, because some of these participants that we have, I mean, if it's 18 to 25, some of them may have been homeless for several years, involved in the foster care system, and might not have the self-sustaining skills that some of us were taught as young children. So it's really helping, getting that trust and gaining that trust, and helping them learn how to sustain on their own.
Skills we might take for granted.
Yeah.
The participants may not have been taught.
Cooking nutritious meals. I mean, we utilize the wonderful thing about Beacon is they have other programs that we can utilize. So we have the health educator. So for cooking healthy meals and those sorts of things, we can ask for assistance on the nutrition for the children. If we have children from 0 to 3, we have the Early Head Start program that participants could utilize if that's something that they're wanting to do. And then the other LIOP programs, I mean, it really is at Beacon. We have several areas that we can utilize together to help that one family. Even though they might be a FACT participant family, they can then utilize any other program within Beacon.
And are they doing that? Are a lot
They
of them
are,
doing
yes.
that?
A lot of our participants are utilizing all of those programs, and it's even more services. I mean, on top of the 7 of us that we have, there's 3 or 4 more people. I mean, it really is the support families, and I mean, it really is nice to have all of these services available. And I think at one point we had LaDonna who was on here, and she was able to talk about all the programs that she's been involved in through Beacon, and that's even helped her succeed longer and further with bettering her future for herself and her children.
Yes. And Sarah, you have a fan club. We got another call. Let's take a call. Good evening.
Question: how you ladies manage to get the message across when children witness domestic violence, whether it's verbal or physical violence? It's trauma. How do you manage to get the message across to parents? Because you got some parents think, well, they're young, they get over it, they don't understand, how it affects children.
Well, that's a great
question.
That's a great
question. I think we see that a lot with the FACT team. I think my team really does a great job of trying to educate the participants on trauma and identifying their own traumas, and then discussing what the traumas of the child may see, and kind of do role plays. I mean, it's a therapy service that would include discussing the effects of trauma. All the teams have all been, the team members have all been trained in trauma informed practices, so we really are aware of the traumas that are out there in the communities.
What's an example? Like what kind of role play for a certain trauma? How would that look?
Well, I think so if you have a child who is doing really well in school, so a school-age child who is doing really well in school, and then they were witnessed an event where the boyfriend hit the mom or whatever, you might see exhibiting in the school aggressive behaviors or increase in aggressive behaviors at the school, but you also might see the flip side. You might see them at school being very reserved, very quiet, and both of those could be the effects of trauma. And then identifying with the mom or the dad, whichever is involved with us, or who wants to be involved in that child's life, explaining that this could be the difference in the behaviors. Maybe they're seeing something in the school, maybe they're hitting and being more aggressive because they're seing that in the home,
and they think it's normal,
and they might think it's normal, and that she's just they're being bullied, which could happen, or they are the bully, and maybe that is trauma. Trauma can manifest itself in children and adults in several different ways. And just our team itself, really, we've built that rapport and that relationship with the participant to be able to tell us, well, what's going on, and how were they acting before last week's event, or how are they acting now? Those kinds of things, and comparing and really discussing openly about what's happening in the home.
And you've mentioned this before, but it really boils down to trust.
It does.
Trust with the participants, with you as a team, and that's not easy to come by. I mean, how many of us just automatically trust a stranger? And that's primarily what it is. I mean, they're coming in as strangers, and you're strangers to them, so to open up is tough. Well, Sarah, I could talk to you forever because there's a lot you guys are doing and great work at that, but we are running out of time, and I want to ask finally if you have any parting words for our viewers.
Well, I think being involved with Beacon and the FACT program are wonderful programs. I think we really are empowering the lives of adults and children, and trying to get them a new fresh start on life. And I think that if you feel that you can utilize one of our programs, please call. Let us try to help you. And I think that's just Beacon overall has several programs that can help the family. So if you can't fit into the FACT program, we have several other programs that you might be able to utilize and help us help you.
Very good. And thank you again, Sarah, for being a guest tonight. We really appreciate it.
Me.
And thank you all for watching, and for our callers this evening. We really appreciate it. One last bit of information before we leave. We have our upcoming 21st annual holiday supper, which is December 6th. So if you'd like more information on that, you can visit our website, or by all means, please contact Peggy Rourke at 773-298-6441. Again, we're Beacon Therapeutic. We're on every Tuesday at 4:30, and we'll hope to see you next week. Until then, have a good night.